Okay, everybody. So Dr. Keith hosting yet another webinar on the Avacia family of miracle devices. I love these things. Ever since I wrote my book, Virtual Medicine, back in the 1990s, I realized that the electronic devices are going to be the Western version of energy medicine, you know, the brilliant equivalent, and they can do amazing things just now. And it's getting better and better. You might think, well, you know, an electronic machine, how is that natural in nature? But as Rob's going to explain to you, we do, the devices use frequencies and, you know, voltages, current, just like the brain. Very, very, that's why it's called microcurrent therapy. Your brain is a hive of electrical activity that we're just mimicking. In fact, we can lock into it, as you'll see. I'm waffling. Let's get over to my expert. Okay, so we're talking about, as I said, healing in the natural way, and it's, as you'll see, it's very, very natural. Some words missing, Rob? What's
I think you might have to click again there.
There we go. Right. All right. So, I mean, one of the things that we're going to address is people don't always automatically, brilliantly, and miraculously get well. Sometimes there are issues and healing won't take place. So we want to address this situation where healing maybe isn't happening in the way that you'd expect or feel you're entitled to. Nature's good at it, but sometimes she needs a hand, basically.
Yeah, definitely.
Okay, so let's, oh, there's another paragraph. Okay, yeah. Oh, yes, let's not forget the little bonus. I've twisted Rob's arm up behind his back. And if you stick it to the end, you might want to take advantage of the bonuses there. It's up to you. Decision will be yours at the end. But anyway, we hope to make it interesting, dazzling. In fact, you know, it is dazzling what these devices can do. And those of you who don't know me, I can't imagine there'll be many on the call. But, you know, sometimes links get shared and friends, you know, recommend and show up that don't exactly know who I am. So there it is in a nutshell. I was British trained, but I live in Las Vegas now. I'm sitting in my room, my office in Las Vegas. And I've written quite a few books. I mentioned the one called Virtual Medicine, you know, virtual as in cyberspace and digital and so on. It's now been reborn as Medicine Beyond, and it means, you know, beyond simple, ordinary, you know, everyday physics, if you like. Most of, you know, everyday physics just doesn't stack up. You have to go into the quantum world and the weird stuff to really understand how our world works. Okay, that's me. You can see Rob, talk us through who you are, what you've done. You're getting pretty well. You're getting pretty well qualified now, aren't you? Credentialed up, as they say in America.
I'm trying, and sometimes that's what it takes, I suppose, to get noticed, especially in the regular medical world. So I'm Dr. Rob Vanbergen. It's more likely people don't know me on this call. So nice to meet everyone. I am one of the owners of Pain Free for Life. And as Keith mentioned at the beginning of the video, founded this company. My parents founded it years ago. And so I'm kind of continuing what they've done with bringing microcurrent to the world. For me, I did my bachelor's in holistic health sciences in 2019, and I went on to complete my PhD and doctorate in natural medicine in 2021, so pretty recently. But throughout my entire life and my career in this business, I have been working with microcurrent almost exclusively. And in fact, my whole research project for my PhD was on non-invasive microcurrent vagus nerve stimulation to actually resolve inflammation in the body. And as you're going to find out as we continue through here, that's very significant to dealing with pretty much anything that's going wrong within your body.
Right. Okay, let's get going then. We're going to take a different position. The orthodox position is mostly you're screwed and it's a pity, but we'll do our best to keep you comfortable until you die. I think most doctors don't even believe in healing anymore. You know, they call that spontaneous remission, and you're not supposed to do it because it throws out all their science.
Right. And when it happens, they're like, well, no, you just got better on your own, or it was what we did. They're not thinking about the fact that something you did could have actually made that change, because that's not possible, right?
Yeah. They've got such limited views of what what can work. And, you know, science, like I said in a recent writing, science has gradually switched from being the truth about what is to being what you're supposed to think now. And it's fast becoming what you're allowed to think. Because if you think the wrong thoughts, you're deleted, you're, you know, got marginalized and got rid of. Okay, so pills, that's what, I mean, doctoring has become a drug pushing trade now. And we have powers and privileges that the Sinaloa drug cartel in Mexico could only have dreamed of. You not only got a free run with all the population, but you've actually got government rules that force you to take their product whether you want it or not. I mean, what kind of business model is that? It's wonderful. Like I say, the Sinaloa cartel would be very jealous. The idea has gradually evolved, and it began when I was, you know, a kid at medical school, that there's a chemical for everything. And this just got worse. The supposition that whatever's wrong, some kind of chemical nut thing will, you know, will fix it. And it's just not true. You know, if your life's in a mess and you're depressed, how is a pill going to fix that? You know, fixing your life is what's going to stop you being depressed. But that's the way it's gone. So talk us through this one, Rob.
Yeah, so I mean, there's always a good side. If there wasn't a good side to something, we probably wouldn't do it. And I'd say that, you know, often when people talk about this concept of getting pain management or pain relief, the good thing that this pill does is it helps lessen the pain and the discomfort, right? But on the bad side, there's so many side effects. And, you know, we see people having shortened lifespans. Some people I know have been told if they take this drug for their RA, for example, it's going to give them 5 good years. You know, maybe they're 60 at that point. So you're buying yourself 5 good years before you snowball into degeneration. And most critically, it's actually impacting your organ function. And it's stopping your body knowing there's a problem going on for a time being. It's suppressing that. And so that will just stall the healing altogether.
Yeah. Sad story. I used to be very proud of being a doctor, but not so much to be proud of these days. Well, here's another thing, you know, surgery, if you can't fix it with pills, we'll chop something out and that'll fix it. Yeah. Depression. If you chop the brain out, you won't feel depressed anymore.
Right. Well, and this is happening so much more now. Like, I don't know, especially with like hip replacements, knee replacements. It's just, well, you've got the beginnings of osteoarthritis. Let's just cut that out, smash it up, put in a nice new metal one, and you'll be fine. And the problem is that that's not always the case. I'd say it seems to be, based on my experience, like 50-50. Is the pain going to go away, or is it going to stay, or potentially even get worse?
Yeah. And of course, there's the money issue, isn't there? You know, it just costs fortunes to have surgery these days. It may not cost you if you're insured, but, you know, somebody somewhere has to pay. But this is the other problem that Rob has highlighted, you know, things going on. And I've got to say, I don't have much faith in the standard of surgery here. You know, you see people have said, say, cosmetic surgery should be simple and straightforward, but they're ruined for life. You know, they lose their voice because their nerve's been cut, or they can't work a certain muscle. The consequences can be disastrous. And for heaven's sake, do not have back surgery, because the most common indication for back surgery is previous back surgery. You know, they do an operation and they got to do another one to try and fix it. And that didn't fix it. In fact, something's now worse, so they got to do an operation for that. I know of people of having 20, 30, even 40 back operations, and still the problem isn't solved.
Yeah. I don't know why they do it, Keith. It's got to still come down to money or something, because I've seen as well. I actually have a baseball player we work with who's retired. I think he's on his 64th back surgery. That's insane. That's just crazy.
Yeah. It's all proof it didn't work. But when you step on that wagon, it's very difficult to get off, because they've now screwed up the nature bit. I mean, a lot of what we're saying is nature's wonderful. She'll help you tap into her wisdom, and we can get miraculous results. But once you cut something out and scar the tissue, all bets are off, because Mother Nature's now been blocked effectively. Yeah,
absolutely.
Oh, I think I jumped 2 there. Did you see that? Yeah, right.
Yeah, that was fast. This is the other thing, right? It's like if surgery doesn't fix it, or if pills don't fix it, then nothing will fix it. That's the medical belief. And sometimes this comes first, but regardless of when you hear it, I don't think there's anything worse of being told you cannot be fixed. There's nothing we can do. And I think it happens way more often than it should. Absolutely. My experience is there's almost always something we can do.
Yes, that's true. And also, if you get to a state of, they've run out of ideas, then they don't like you coming up with other ideas. Oh, well, I'll go and see a naturopath. They get very defensive about the fact you might want to go and see somebody. And part of it, I'm sure, Rob, is part of it is that they don't want to be made to look stupid. They say there's nothing we can do. And then you go around the corner to an osteopath or similar, and you get fixed in a fortnight. It makes them look damn stupid. And I think that's some of their motivation too, some of their hostility to these wonderful alternative cures. Anyway, we go.
Yeah, so I think this is what I was just sort of saying, actually, that really, like, what if rather than accepting the fact that we have to take pills, or that we have to have surgery, or that we have to do nothing because there's nothing we can do, we just challenge that point? Because what we have seen time and time and time again over the years is that you can resolve chronic disease, illness, pain. It almost doesn't matter what it is without any of those things. And you're really hitching a ride along with nature's awesome ability to heal you and just get things fixed. Yeah,
I want to re-emphasize it. I think it comes up in a later slide, but although it's electronic, it's very much on the nervous system and brainwave frequencies, and that sort of energetic level. It's not over, it's not like in Victorian times, they'd take a comb and deliver it, go like that and hope to get a result. This is very subtle and very wise.
Yeah, and this is the reason, right? And people need to think about this if they haven't already. But our body is designed to heal, like on a biological level. So when we ask the person, well, why is your body not healing? The answer is often, I don't know. But we know that we're not built to fall apart. It doesn't make any sense. We regenerate all the time. We have our entire lives. So when we are not, what is blocking it? Something is standing in the way of recovery, and we need to identify what that is and remove it from the equation.
Yeah. I mean, nature can fix almost anything. I mean, if you break a bone, for goodness sake, you shatter a bone, it'll still heal. And even if you don't have a splint, you limp around, it'll still heal anyway. You might have a crooked leg that way. The splint's good because it means it'll be straight the way you want it, but nature can still heal.
So this is the problem, right? I mean, this is my identification right away, is that if not all, at least 80% of all chronic disease, illness, and pain is the result of inflammation. When we look to inflammation as something that actually wrecks the body's communication system, it actually causes you pain, it blocks the healing process because it stalls it in acute healing. Then we know what we're looking for is that it's this inflammatory response that is inappropriate that we need to look at removing.
Right. No, I'll step in and do your dad's bit at this point. But of course, inflammation is extremely valuable in fighting infections and acute diseases. We absolutely want inflammation. It's a way of limiting the toxins or limiting the invader. If it's a bacteria or a virus, it seals it off. And there are certain characteristics, you usually get swelling, you get pain, it's hot and looks red. And in fact, inflammation, because it is fire, if you've got inflammation going in the joints, anybody would know that they feel hot. So that's acute inflammation is good for us, but chronic inflammation is incredibly destructive, like Rob was just saying. It will eventually ruin your body and turn it into a very conked out motor car. And here's the problem. Well, you can explain this.
Yeah, I mean, drugs function as a mask, right? So what we've been trained by society to do is to listen to our doctors. They're gonna be the one that heals us, and they're gonna prescribe us something that's gonna take the pain away. So these medications, they'll cover up the pain for a while. And it doesn't seem to matter if it's pharmaceutical or if it's marijuana, or if it's something you buy on the street. It doesn't seem to matter, because what it's doing is it is masking the problem. It is doing nothing to fix it. So you put on this mask and you go about your day and you're happy for a while because you're not feeling the pain. But because underneath all of that, the inflammation stays and it keeps burning, like Keith said, like a fire. Because you keep masking it, it gets worse and worse and worse. And it begins to, instead of getting your attention because you're not listening to it, it's just breaking down the structure of our body. And then the issue turns from acute to chronic. And that's when you get stuck in these snowball effects, years and years of pain and illness and disease spawning one off of the other.
Right. Now, do we have a slide for this, Rob? Yeah, we often use the example of the warning, red light warning.
Yeah, I think my version is the bedroom on fire. I think that's coming up.
Okay, that will do. Yeah.
So,
well, this, if you look at the orange in the box on that, that's the critical. Oh, I'm frozen.
We can still hear you though.
Yeah. Okay. So I mean, I thought I got miraculous bandwidth here. I mean, the modem is just over there. Oh well. Okay, you keep talking in case my voice.
Yeah, sure. So yeah, I mean, and this is the critical point here. If we're asking the question, why are we not healing? Well, we have to look to that point that it is impossible to regenerate in the presence of inflammation. So when that inflammation is there in the acute stages, it helps to prepare the body to heal. But when then it's supposed to turn off and go away so that your body can start the repair process. It doesn't do that. If the inflammation and pain stays, then this is the chronicity, which I think is a word, starts to develop.
Synchronicity. I wonder if chronicity is a word. Yeah. Scrabble users would know, of course.
Absolutely.
Okay. Maybe there's, okay. Maybe there's a little issue on my computer that was quite sluggish when I advanced the slides. Okay, take it away, Rob.
Yeah, so then this is the answer, right? Like, if the obvious answer is that the root cause of disease is inflammation, then we just need to shut down the inflammation and we will cut the powers of the disease. And this is ultimately what microcurrent therapy can do. It enables us to shut off the inflammation.
Right. And to be clear, just taking ibuprofen is not a good answer because of what Rob was saying. The side effects are more deadly than the problem, and they can be very serious. So many painkillers have. I think that group has the most horrible side effects. And one of the reasons, one of the things I teach about painkillers, essentially they're poisons. They poison some part of the nervous system, so you don't feel anything anymore. That's not a good solution, is it? Okay, so.
Yes, microcurrent therapy. So here's the question. Well, what is it? And that may be why many of you are here, is to just get this answer right away. And the most common response when I'm talking to someone on the phone or when I do one of these interviews is people's first go-to is, this sounds like a TENS device. And maybe, or this is a PEMF now. That happens less often, but and the answer to both of those questions, is it either of those things, is no, it's definitely not. And on these next few slides here, we are going to explain the difference between them, just so that everyone can kind of get those big questions answered right away.
Yeah. Okay, so there's some text here? Oh, here we go.
Yeah, there is. So yeah, a TENS device is essentially working to paralyze the pain receptors in your body, blocking pain signals and masking your pain. It's like a Tylenol, just electrical. So you apply these pads to your body and it hits the body with so much electricity. I think it's over 1,000 times more electricity than what we use in microcurrent to, as Keith said earlier, paralyze, block those pain receptors, block the nerves so you don't feel it. And TENS units, they come with so many different contraindications. You can't use them in so many different scenarios. If you've got anything in your body that's not natural, so if you've got an implant of any kind, if you shouldn't treat your chest because you might affect your heart poorly. It goes on and on and on. No working on the brain, definitely no working on things like the vagus nerve. And these things all compound to make a device that essentially you can't use. And even if you do, over time, you're often not going to reap the benefits of that pain relief for very long.
Yeah. Oh, more. Okay, so we've done that, really, haven't we?
Yeah, we've done it.
Oh yeah,
I know
yes. Your little joke at the end.
Yeah.
It
The
doesn't
warning
suit,
label.
doesn't suit living organisms. Really, it's a bit equivalent to, like I said, painkillers are poisons. It's a bit equivalent. It's knocking something out as a way of solving the problem. Just like covering up the warning light on your dashboard, or we shall come to another example of that shortly. What's PEMF? A lot of people might have the question, what is PEMF? Why is it, never mind,
Yeah.
different to microcurrent?
Yeah. So I think there's a couple more clicks.
Oh yeah, sorry.
There. But yeah, PEMF is similar. It's frequency generated waveforms. So we do the same thing with our microcurrent devices. We're generating frequency, but we deliver them in an electrical impulse. PEMFs are like a healthy electromagnetic field. So if you're watching this on a phone, a computer, whatever it is, that device is emitting electromagnetic fields. And these EMFs that are coming out of us are not usually great for us. But when you use the PEMF, you can actually adjust the frequency to try and resonate with the body's cells. But what you're doing is you're saturating the area of the body with it. And these frequencies, they are there. They're like a presence, just like all of our electronics are. They are not live. They're not tapping into the nervous system and shooting through your body at lightning speed. They're just hitting the area and trying to encourage cellular change. So flooding this area in frequency, there's definitely some benefits to PEMFs, unlike TEMS. But the truth is that microcurrent is often faster and more effective in almost every case.
Yeah. Oh, last tiny line. So microcurrent. A bit. Listen, next time we do slides, have all the right
All words on the one. Yeah, I'm thinking the same thing.
Oh, okay. So let's go back to the full slide.
So microcurrent. So microcurrent is a system already present in our bodies. So if you are watching this, if you are living, you have a working microcurrent system. This is your nervous system. This is the way your body communicates with your brain. Your brain sends these little electrical impulses through your nervous system from it to your body to ask it to do different things, whether that be create inflammation because you just stepped on a rock and it really hurt, or you broke your ankle, or whether it be to turn that inflammation off, trigger repair, even get your muscles to move and react. This is why we have these lightning fast reactions. You go to step out in front of a car and you see it coming out of the corner of your eye and you know to pull back because your brain sends that signal that fast that your body can react. Now, microcurrent technology is harnessing this natural electrical system, and it's doing this by sending gentle signals into the tissue that match the body's own signals, asking it to turn off inflammation, trigger regeneration, heal the body, etc. And so we do this in a way where we're mimicking the body's communication system. And essentially, it's like imagine it like if you had a remote control for your bodily function. That's really what you're getting at here. You have the ability to tap in to this amazing healing system. Did we just lose the slides there?
Well, you froze as well, so we're having technical troubles, folks. And
I do apologize, everyone, if there's any issues on my end. We're having a pretty bad storm, and it's been going on for a few days here, so things are a little shoddy.
Well, I seem to have frozen more than you, and all I can see out the window is blue sky and sunshine. So it's not the weather. I don't know what's wrong, but let's just keep going anyway.
Yeah.
Yeah, I mean, later we're going to use this. We're going to talk about dialing up the brain, aren't we? And it's like making a phone call to the brain. We know the frequencies, we know how to dial up, and these brilliant devices will actually tell you when the brain answers. The brain
Absolutely.
Says, oh, who's there? And it gives a ting-a-ling-a-ling when it's got the message. So it is a bit like throwing a switch. That's just a simple illustration that we don't need to dwell so long on that one.
Yeah, absolutely. It's really just that ability to flip the switch on inflammation.
Yeah. Okay. Come on. Oh, did I jump to again? Yeah, my system has gone slow. I can't think it's the same thing bothering me as bothering you, 2,000 miles away in Vancouver Island. I don't think so, Robert. Whatever,
Yeah,
we're bedeviled today.
we seem to be.
Anyway, so we're going to talk about, like I said, the promise in my invitation email was that let's lay them all out and talk about what they can do, and how much they cost and why you'd want one, and you can make choices and things instead of Rob and I picking what we think would be the most appropriate one or two. Once you know what's what, you can decide what's right for you. So let's take a look anyway.
Absolutely.
We're going to talk about, there's 3 devices there, but let's spend a bit more time talking about what they can do. We've kind of boasted it a bit, but let's see some of the results. One of them is working in neurofeedback.
Yeah. So being able to use electrical algorithms that if you know anything about the brain, you know that the brain operates on different waveforms, and it doesn't actually really go above about 40 hertz. And these different waveform stages happen from, when you're fight or flight, when you're working, to when you're sleeping, meditating, whatever it may be. And what neurofeedback allows us to do is it allows us to use these electrical impulses and essentially pass the current through the brain and manually adjust the brain waveform. So the way we're doing this is we're using these ear clips that come with the devices, and 2 of the 3 devices today have neurofeedback capabilities. But this allows us to work on things like sleep issues, stress, anxiety, even depression, PTSD. If it's brain fog, dementia has been something I've been seeing great results with recently too. If there's something going on with the brain, the device can adjust those, again, tap in and adjust those brainwaves and actually make these positive changes.
Right. But it can do so much more than that. Oh,
so much more.
Sorry. Here we go again. And more. Yes. Okay, let's go. So explain what alpha mode is. I think most people know alpha brainwaves.
I would say most people do. Alpha is my favorite brainwave mode, and it's probably most people's. It's when you're calm and relaxed, when you're resting, you're digesting, and you're repairing. So alpha enables us to keep people out of fight or flight mode. It reduces body stress and it enables the body to repair. And when we are in alpha, we are safe. And if any of you have ever heard my dad talk about this, he'll always talk about running from the bear. When you're out and you're walking, and this happens in Canada, I've got a bear that lives on my street. If you're out putting your trash out and a bear sneaks up on you, you're going to run. And when you do this, you immediately leave your alpha state and you go to this beta survival state. Now, people in chronic pain are running from the bear consistently. And so being able to put them back in alpha, get them out of that fight or flight mode, is part of the key process to actually healing the body. And this is great for improving sleep as well.
Right. Yeah, emphasize at this moment, folks, that it's not just about putting clips on your head and directly and training your brain. You use this device anywhere on the body. It depends what the problem is. But we're starting here with these important psychological ones, and it's a pretty open study. I mean, nobody could command it or claim it was a brilliant double-blind crossover randomized. It wasn't, but the results are so good. I mean, when 95% of people say they're less anxious.
Yeah, it was pretty incredible.
Yeah, I don't think it's as important as trying to prove it against a placebo, is it?
No, I don't think so. And really, we'd already seen the NIH, the National Institutes of Health, were actually playing with this for veterans and PTSD. And we just wanted to see if we could mimic that through copying it with our machines. And yeah, a lot of our users were like, well, I want to try it for this and this. So it's like, okay, we'll give it a shot. And these were the results. I mean, even 90% improved sleep length for people that barely slept. Like, that was a huge one. It does kind of correlate. If you're less anxious, you're less depressed, you're probably going to sleep a bit better, maybe be better in that way. But yeah, there's nothing to sneeze at there. That's for sure. And it's really easy. You just apply the pads to the forehead. We've changed that a little bit nowadays, a little bit more center. And you just run this gamma brainwave program, and you're filling the brain with these gamma waves. And it makes the difference.
Right. Rob, I'm gonna kill my video because it's probably using bandwidth and everybody knows what I look like. And you're the one that I want to do most of the talking. So I'm actually just going to knock out my video and just see if we can stop this silly freezing. It's annoying.
Sure.
Okay, so I'm still here, folks. You'll still hear my voice. I'm part of the conversation, but the visual part takes about 80% of the bandwidth. So that should improve things. Let's see. Okay, so we'll go on to the next slide and see how we're doing from there.
Perfect.
Okay, now almost everybody, I think, these days has heard of vagus nerve stimulation. And one of the reasons is it's now orthodox medicine. It's not woo anymore. And it can do all sorts of good things. So tell us about the vagus nerve, Robin, what it does and why it calms and soothes inflamed and excitable tissues.
Yeah, so everyone, you're right. Almost everyone has heard of vagus nerve stimulation, though they may be looking at it from the surgical aspect, which we'll talk about in a moment. They may also have heard, you can gargle and do all of this stuff to activate the vagus nerve. It's become increasingly popular as we go. But this is probably one of our most important anti-inflammatory techniques for anyone suffering from pain beyond just one area. If you've got a sore shoulder, you don't really need vagus nerve, though it will help. But what the vagus nerve does is it's this nerve that runs from your brain. It's one of the cranial nerves, and it touches almost every vital organ in your body. Crucially, what research has shown is that by stimulating the vagus nerve, you actually block the production of tumor necrosing factors. So you actually stop these inflammatory things being created, and this will prevent or reduce these symptoms of autoimmunes, which huge, getting more and more prevalent nowadays. Chronic conditions like CRPS, fibromyalgia, and really
explain that. Right? You're getting like your dad. He just wonders
CRPS.
If everybody knew everything. What the hell is CRPS? I know, but tell them.
So CRPS is complex regional pain syndrome, which is a condition that is considered to be the most painful condition in the world. It's equivalent to cutting off a finger without no anesthetic. And you're essentially, you're feeling that pain all the time. So people with CRPS often become disabled and even resort to amputation to solve their pain in that affected limb. So it's one of those things that doesn't really have an answer, but by stimulating the vagus nerve, we can turn that all down. We can get the inflammation to go away. And yeah, it is the thing people want nowadays, and for good reason. Right.
I know you've got a brilliant video. We haven't room to show it, but just a girl with chronic regional pain. She was reckoned it was about an 8 or 9. She was down to 1 after the first treatment, and then she needed a couple more treatments, and that was it.
Yep.
Walked away. You didn't see her again. She was doing so good. It was amazing that these things can be achieved. Okay, so this is how orthodox medicine wants to do it. They want to slash open your neck, get a hold of the vagus nerve, clamp an implant device on it, stick a battery in there so that they can make it fire off every few seconds. Of course, it's going to be ghastly expensive, 20, 30,000, who knows? I mean, it'll end up hugely expensive, but if you were crippled and now you can walk around, you probably think that's a justifiable expense. But the point is, you don't need to pay all that money. That's the ridiculous way of doing it. And don't forget all the complications, scarring, infection, all sorts of things that can take place once you break the viability of the body's skin. So we have a better idea. Oh, hang on, there's more writing. Okay. Okay. I didn't notice that when I was reviewing the slides because it throws them all up together.
Yeah, it does.
Yeah. And did I say this, that, the nerve implant device needs replacing every few years. So, you're not in the clear just because you've had it once. It's going to have to be redone over and over.
Absolutely.
So it's not a good solution, really. But this is our way of doing it.
Yeah. And interesting enough, this mimics the version that they did in the original studies. So that their conversion of it into a monetizable model where they can do an expensive surgery to implant it is totally unnecessary, because the original studies involved just zapping the vagus nerve. And if that's all you need to do, you don't need to cut into the person to do it. So this is easy to perform. It really has zero downside. You're taking your electrode, you're finding your carotid artery, just feeling for that. you're placing the electrode right behind it, and you're leaving it there. We also even have a sticky pad that's included. You can just slap the sticker on your neck and be hands-free as well. But this is just an alpha frequency that helps to stimulate the vagus nerve and stop that inflammatory response.
Right. Just to be clear, Rob, that we're doing that for a few minutes, 10, 15, 20 minutes most, really.
Yeah, that's correct. Yeah. So 3 minutes, 4 times a day, or once a day for about 12 minutes is kind of where we're at. And that's all you need to do to get that vagus nerve trained and actually change the tone of it and the way it interacts with your body.
Yeah, super easy then. Okay, now pons. I know Latin. I was taught Latin, and pons means bridge. Explain this term to us and why this has become huge. Is it Deutsch, Norman Deutsch that came up with this therapy? Yeah, but we can simplify this. Explain it to us, Rob. Yeah.
So the research that Dr. Deutsch came up with, Deutsch, I still don't know how to pronounce it to this day, is that he found that by stimulating the tongue, we could access the nerves in the tongue to kind of bridge the gap to the pons. And then from the pons, as you say, as a bridge, we can access every cranial nerve in the brain. So what he did is he came up with this research, and then a company called Helios Medical came up with a machine that only did tongue stimulation. That was what it was. They would put this little thing in your mouth, and you would stimulate the tongue, and you would wear like a headset. And it cost, it's not approved in America. It got approved by Health Canada really fast, like overnight, scary overnight. And it costs, I think, $30,000 to $50,000. It is not covered by any insurance, and you only get the machine for 6 months. But what they were looking for is this concept of creating a treatment that can actually resolve traumatic brain injuries by correcting the cranial nerve. And they also were looking at Parkinson's disease as well. We've taken this beyond that, noticing that we had the right frequencies. Dr. Deutsch mentioned them in his book, and we had a good microcurrent machine already. All we needed was something we could put in the mouth, and so we created the tongue stimulator here, really small device. And you put it in your mouth, you put it on the tongue, you close your mouth, and this we've seen even treat tremors. We've used this for treating ALS. Recently, long haulers COVID as well, like where people have these lasting symptoms, we've been able to erase those with tongue stimulation. And we've even seen people correct the eyes and hearing, different things like that, because all of these cranial nerves are connected in the pons. And this is giving us an access point for direct microcurrent. So Deutsch's research has proved invaluable, but why spend $50,000 when you can do this with, and for 6 months when you can do this for a lot less? And get many more benefits as well.
And you keep the device for a lifetime, and you can use it with family, friends, anyone you like. So you've got a lot more freedoms if you actually own a simple handheld device. Yeah.
Absolutely.
Now, be clear. So you've got to say it for them, Rob. It doesn't hurt. Yeah.
No, you'd think electricity and the mouth probably don't make sense, but it feels like a little tickle on your tongue. You don't even need to increase the power. You just put it in your mouth, you turn it on, and you just feel like a little buzz. There's no pain.
Right. And that's important. And there's a principle there, actually, Rob, which I should just bring out, I guess. But, in biology and good holistic, healing and understanding of the body, a little bit is all you need.
Yes.
And whereas orthodox medicine thinks, well, if a bit works, we'll turn it up and have a lot more. Actually, what happens is when you turn it up, it stops working because you're overloading the system. We're talking essentially information and language. We're not talking voltage at all with these devices.
And I just want to carry on that point, actually, because it's a really good point. You don't need to go back on the slides. But what I saw when researching for my PhD, because you had to research all of the stuff, right, that's to do with microcurrent, was every study without fail that showed microcurrent success always proved that less is more. Shorter treatments were the best, most optimum option. And in every case, when they compared longer treatments versus shorter treatments, the shorter treatments always provided better results. So that kind of goes to prove your point there.
Yeah, well, it's kind of counterintuitive, but orthodox medicine is definitely on the wrong track with this more is better, you know.
Mhm.
Okay, now scar tissue is very important in what we're talking about, and Rob will explain why.
Yes. So scar tissue, we create scar tissue when we get surgeries, but we also create scar tissue when we get injured, whether it's an actual cut or whether it's a twisted ankle or a break, something that doesn't expose the surface. There's damage done to the tissue that needs to be repaired. And so scar tissue not only can cause pain, especially in the form of adhesions where you move and you feel this like pulling pain, but scar tissue creates a communication blockage. And my dad used to describe it like a beaver dam, right? It's stopping the river running and the water getting through. What we're seeing here is a similar situation. We're getting a communication blockage. The nervous system cannot pass the electricity through the scar tissue. And so you get this blockage, which then contributes to increased inflammation, and it impairs the healing process. And in your cells, they are trying to communicate electrically, but they can't do this through scar tissue. So the signals actually have to find another path, which can often result in them getting lost and not making it to the right area. So scar tissue can be at the root of anything. And it doesn't matter if it's 30, 40 years old, it can build up to that point as well.
Right. Now, if you think you haven't got any scars, I'm perfect. You've got to think of hysterectomy, tonsillectomy, appendicectomy, having teeth extracted. These will lead to scars in the body, just hidden scars. You may not be aware of them, but for sure, the scarring is there.
Absolutely.
Okay.
And someone pointed out to me that your belly button is also, everyone has a belly button unless you're a clone. So, and that's the scar as well.
That's true. I never thought of that, but yeah. Okay, have we said this?
I think we've pretty much said that. Well, so this is kind of how the microcurrent works on the scar tissue.
The first rule, yeah, explain.
Yeah,
that.
so this is our first rule of microcurrent. Whatever is wrong with you, you will be treating your scars for the first day, probably. Once you've done it once, that's all you need to do, because treatment of microcurrent with the correct frequencies actually neutralizes the scar tissue, and it allows the electricity to pass back through it, because the scar tissue can then take on water again. And so once the water comes into it, it becomes conductive once more. So it really restores lots of stuff with one short treatment. And you can also take it further. Many people want to know whether they can actually break up the scar tissue and replace it with healthy, normal tissue. And the answer is yes. It does just take, it takes a little bit of time compared to just neutralizing it, but it's definitely something we can work towards. Right.
Now, you mentioned water there. So just to explain to the folks, Rob is talking about collagen. There's collagen lined with water, which is ideal. In fact, it's a liquid crystal network. It's brilliant. If you press the back of your hand, the opposite ankle knows instantly, because it's very much a liquid crystal system, as I said in my book, Medicine Beyond. So it's very important to keep that in good, healthy condition. Okay, let's move on. Oh, that's a before and after, is it?
Yeah, it is. This was a camera guy we were filming, and my dad John was like, "Does anyone have a scar they want to treat?" The camera guy put his hand up, and yeah, he'd gotten this big scar on his back, and you can see like one treatment right there. The bands, the tense little bands that are there on the scar on the left are gone with one treatment. You actually will feel that the scar flatten out as well.
Yeah, interesting to see that a month later. Okay, but we're back. First rule is treat scars. Second rule is we're going after inflammation, because that's key, as Rob explained.
Yes, and whether we do that through vagus nerve stimulation, whether we do that through treating the area that hurts directly, we're trying to remove that inflammatory response so that people can get the health benefits of that. They can start to heal. And this can be done in as little as one session as well.
Right. Important. Okay, and then when inflammation's out of the way, then we can get regeneration, but not before, yeah?
Yes, exactly. So as you said earlier, we cannot heal in the presence of inflammation. So once we remove inflammation, we can also encourage cellular regeneration. Again, this is all sending signals the same way that the brain sends them to the body. So we're just enhancing the body's ability to do this. So being able to get in there and repair damaged tissue fast, whether it's a severe wound or a tiny cut, it's key to being able to use those components as well. So we can remove the pain and we can also reverse the damage done.
Right. Now, these devices of yours, they have certain regeneration frequencies, don't they? Good ones for bone or for nerve tissue or for muscle. Optimum frequencies are actually in the devices. So best of both worlds. Brilliant. Yeah. Now, this will integrate with other systems, won't it? Chakras. I mean, the most sophisticated of the Avacia devices can broadcast chakra frequencies.
Yep, we've got chakras, we've got meridian points, we can do the acupuncture points. It's all optional, right? It's nice to be able to have those options. They're not required for people to actually get success in most cases, but it's nice to have. And all of the devices can work with meridians, and then our higher level ones can work with the chakras as well, which are incredible for emotional trauma.
True. Yeah.
You're gonna have a couple of
nice. Another of these. All right. Okay.
Yeah.
So it's what we said anyway.
Yeah, exactly.
I just didn't realize there was more text behind it. Okay, so I've often likened this idea to an on-board pharmacy. You know, that nature's wise, nature knows what she's doing. She can fix anything, as we've said over and over, but everyone's experience is that nature can fix it. But what we do is talk to the brain, and the brain has everything at hand, all these neurotransmitters and chemicals, you know, the inflammatory, you know, the inflammatory cytokines are counter chemicals for all of that. Nature can deal with it. She just wants bringing into the loop. And that's how I think of these devices. It bring Mother Nature back into the loop. However, the person's got screwed up, Mother Nature's got the capability of sorting it out, basically.
Yeah.
Okay, we've got some writings on the right there. Yes.
I'm sure. Yeah. But yeah, it's everything that you said. Like we have this innate ability to heal built within us, and by drawing attention to the problems, we can harness that and make it work for us. As you said, nature knows.
Yeah. And I don't know if we've got the telephone one.
I don't think we do.
Dialing up the brain. Well, maybe we'll put that back for another. Anyway, all right. It's still, it is dialoguing with the brain anyway, as we've said.
Yeah.
So is there yes.
It's super simple, right? I mean, you put this, as you mentioned here on the slide, you put the electricity, the device directly on the skin, the frequencies enter the skin, you feel a little tingle, this triggers a brain response, the brain acknowledges the problem, and the body and the device can then work together to fix it. So it's involving that onboard pharmacy, involving everything about your body and getting it to function the way it should be functioning.
Right. Now, let's be clear. It is a tingle, right? You're not bluffing and saying, "Oh, come on, you big Jesse, pull yourself together" when somebody screams.
No.
Scream because nothing happens. It is literally a tingle. You can almost not feel it. In fact, you could tune it down to where it's only barely perceptible. It will still work, won't it, Rob?
Absolutely. And we actually recommend that, like, keep it to the point where you can just feel it. You don't, as we said earlier, you don't want it to be uncomfortable. You shouldn't push the power to, well, I've got to feel the burn if I want to succeed. That's not the case. You really do want to just feel it like a gentle tingle. And it's really easy to adjust with over 250 different like power options. You can just adjust it to what you can feel.
Yep. And I can vouch for that, folks. Now, I think let's assume everybody more or less knows what mitochondria are. They're little things inside your cells that juice up all the energy. Without good mitochondrial function, you would crawl around, you'd be fatigued, you wouldn't be able to raise the energy to go and make a cup of coffee. So it's important to keep your mitochondria going. What can we do?
Yeah, so we have developed a protocol. We've only really been doing it for the last few years. We call it mitochondrial recharge. And what it's really doing is it's charging up all of the cells in your body. We're adding electrons to it, and we're essentially giving the cells the ability to optimally communicate. And when we know that when cells are a certain voltage level, they actually cannot become diseased. Their action potential will carry on. They will not falter. And so this will end up improving your overall health because you will not have as much potential to break down. So this is a really easy to perform protocol. It's passive. You hook the device up and you sit down, you read a book, you watch TV. you just relax. And 30 minutes of this alone has shown to improve the body's ability to communicate with the brain, improve energy and reduce fatigue, improve muscle weakness, and really improve every other treatment that we do with the device. And this is just due to the optimization of the body's energy and the electrical network within it.
Right. Okay, listen, I'm going to put my video on just for a second. People still popping on the call. I am here, but we had some bandwidth trouble and I kept freezing up. Rod froze up a couple of times, but it kept happening to me. And I thought, well, I'm fairly dispensable. Nobody needs to see me. And so I'm here asking questions and talking with Rob, but I'm letting the video go. So if it mystified you a bit, that's the explanation. Okay, moving on. Oh yeah, now we did a whole webinar last time talking about problems for the ladies, and they do have problems. You know, I wouldn't like to come back as a woman. I don't know about you, Rob. They have some bad stuff, you know, monthly pains and inconvenience. Having a baby, I mean, if you've been in the labor ward and heard the girls screaming, it doesn't sound fun. Although it's very interesting. They have this sort of natural forgetfulness, you know, an hour later, they're starting dreaming of the next baby, even though the one they've just produced created agony for you know, 10 or 15 hours or something. It's really, it's very strange. But anyway, on the whole, the girls have a bad time. And I introduced this term, the hot pelvis. You could call it an inflamed pelvis, it doesn't matter. But, you know, long before microcurrent, I was calling it the hot pelvis. And it can be inflammation or infection anywhere, you know, the vagina, in the uterus, along the tubes, actually in the abdomen itself. And you've got inflammatory conditions like polycystic ovaries and things like that. It's bad news. These devices are the best answer I know, in fact. And we should go back and rerun that webinar sometime, I think, Rob. It's a great service to the ladies and can often head off nasty things like, you know, hysterectomy. They say, oh, we'll just take it all away. You'll have no further trouble. Well, you won't have that trouble anymore, but all hell breaks loose when a woman's had a hysterectomy.
Oh, yeah. Ghastly,
absolute hell breaks loose, and they never warn you. I mean, I think they would probably scare women off it if they did.
Oh, probably, yeah.
If they told the truth, nobody would go in for that. Anyway, listen, I'm waffling. So that's another area where it's got an enormous amount to contribute. It's very effective. And orthodox medicine has very little. As I said, usually say, well, just take it all away, then you're done. It's not a good solution. And women, they hurt, you know, I mean, they don't feel quite a woman anymore because, you know, they just can't now procreate. I mean, you can still enjoy sex. I'm not saying that, but, you know, if you're a woman of a certain age, you know, baby is a drive. And all of that's taken away, and she's not capable. So it can hurt psychologically as well.
Yeah, and
I don't think we need to dwell on it. We're saying the same thing. The pelvis can be a very hot area. We all know. Listen, the two really bad areas. One is the mouth and the back of the throat, the so-called pharynx at the back of the nose. It is filthy, and there's constant inflammation going on. Even if you've not got raging tonsillitis, you know, there's all kinds of bugs and pathogens there, and you swallow them and swallow them and swallow them, and they often set up home in the gut and they cause trouble there. That's one of the really bad areas. I'm sorry, I just realized you can't see me. I'm busy demonstrating. Well, never mind. And the other one is the pelvis. Now, guys have pelvis trouble too, nothing like women, but, you know, we do have prostate problems, as you know, prostatitis. The swelling can be a very big inconvenience. And by the way, one of the first figures that ever impressed me was the huge success rate the Russians were claiming for the scanner, which was, you know, the very first version of this technology, the Russian scanner. And benign prostatic hypertrophy was it was kind of a cinch, you know, it was so easy to fix using these devices. Okay, now what are we saying here? You treat it somewhere else?
Yeah, pretty much. So, you know, you can treat the area that hurts, and sometimes that works. Other times it doesn't. And being able to utilize trigger points, like they do in pain management, acupuncturists use them as well. The books for the devices come with all these trigger points. So in this example, if you were feeling pain in the hand, and you treated the hand and the pain wasn't going away, you could then treat the black X marks the spot. And you would often resolve that pain because it's likely being referred from that area. We all know probably about referred pain, but this is just a way of identifying these areas of referred pain.
Well, maybe people don't know about referred pain. You know, we're not all medically
Maybe not.
trained, Rob. For example, if you've got an inflamed gallbladder, one of the curiosities is you often get the pain, which is, just realized I can't demonstrate. Okay, the gallbladder is here, and your person feels the pain up at the back, high up on the shoulder blade. That's referred pain, because that's not where the trouble is. The trouble's here in the gallbladder. Right. And another good example, a common example, is if a person has a hip problem, they feel a painful knee, and the knee hurts, but the problem isn't in the knee, it's the hip that hurts. So that's what we mean by referred pain. And are we going to show what the Pinnacle device can do, that it can take readings and tell you where to go? Is that
I don't know. I don't know if that is a slide, but I can certainly talk through it. I do.
Well,
I do
talk through it now then, in case.
Sure. Yeah. So when it comes to the Pinnacle machine, which is the top of the line device here, you end up getting a screen. And you can see that screen on there. It's backlit, so you can't see it very well right now. But what the screen lets you do is it lets you take readings. So by touching the device to the body, you're going to get a displayed number. So let's say we get 3 different areas. If we have wrist pain, we could touch the area here and we could look at the number, and then we could touch the hand, and we could touch further down the arm. We could really check everywhere, looking to see which number is the highest. So in the case of this, what we'd be looking for would be the highest point of inflammation. So while it hurts on the wrist, you could find that the pain's actually coming from down here. So all of your treatment on the wrist could be totally ineffective, providing just mild relief. And then this device at a glance could tell you, okay, the pain's actually coming from here, and you can treat that area to resolve the pain here. And it can be that can be used anywhere on the body. And it really is 1 second to give you that displayed number.
Right. And they're often really astonishing surprises, aren't they? Where the trouble really is coming from. It's like, what? The practitioner is almost puzzled sometimes.
It's true. Well, you might roll your ankle, and and that's definitely where they injured it, but it's actually further up nearer the knee that the pain's coming from, the problem's coming from, and the healing's being blocked. It is astonishing. Yeah,
but we do trust the device. If it says work here, we work here. Otherwise, it's likely to be disappointing, isn't it?
Yeah.
Okay, there we go. Right. These are some actual physical. These are from old presentations we did, but they're so amazingly brilliant. I mean, I know it's not your patient. I think it was your mum or one of the students of your college anyway. But this is a Russian guy? Was he an electrician, I think?
Yeah. So he was working with an electric arc welder, and it blew up on him. And so you can see the burns there on the left, and the swelling. And the swelling may not be perceptible at first, but when you look at the far right, you see the after, you can see how much that swelling was there. So this was the first picture on the left was done, was the initial injury. Then 4 days later, just with daily treatment, you can see so much of the tissue was already healed on the face, and this slightly reduced swelling. Following that up, I believe that would have been another 9 or 10 days later. He actually looks completely normal to me. I think it's kind of astonishing.
Look, it started on the 24th of October, didn't it? Yeah. On the 28th, which is only 4 days later, that's the middle one. But look, the 7th of November, which is still less than 2 weeks later.
Yeah. And he's back to what the normal medical system, my understanding, would have done there is hospital, debriding, repeatedly creating more inflammation, removing the dead tissue. And it would have been a much longer process than essentially a 2-week healing process.
Yeah, and there are his hands. Obviously, at the bottom, he got burned with the flash. Looks at least second, and maybe some of that parts of that are 3rd-degree burns. And again, the same time, by the 7th of November, their hands are still discolored, but they're healed over. There's no open wounds anymore. So that's the kind of miracle we see. And then a story I love to hear Rob's dad talking about, John. He was a military guy, I think, and he'd gone up to the far north of Canada on a training thing, got frostbite. And of course, the usual story with frostbite is that they're dead, they've got to amputate, there's no possible cure, and he was scheduled for amputation on he went in on Friday and scheduled for amputation on Monday. Didn't happen because he came to see the Avatzia users, Rob's father, John Hachey. This is more what you were seeing, wasn't it?
So just the 4 days later, you can see the
that's
gone off the toes.
I was just troubled by the heels. Anyway, the toes have recovered. Now he needs to clip his toenails, for goodness sake.
Yeah.
But he's not lost any toes, and he isn't gonna. It's wonderful. And then, it's a different case, isn't it? But if I go back to that one, I mean, the final part of the story, the guy was so fixed up and happy that he threw a bottle of wine in his rucksack and jogged over to the home of John Hachey to say, thanks, look at me. That's instead of losing toes. I mean, that's as good as, it's as near a miracle as you're going to get without the hand of God, I think.
Oh, absolutely.
Do you know this case? Can you help me here?
Yeah. So this was, I believe this was in Australia, and this was during COVID. So you weren't allowed to visit. This was a nursing home fall. And so you see a lot of these like sores and injuries that don't heal in nursing homes. And so when the guy in question was able to finally get in to visit his relative, he noticed this wound, and they were like, yeah, well, it's not healing. They just keep, pasting over it, covering it up with a bandage. So he started daily treatment on it. And as you can see from red inflamed tissue on the left and that big open sore, you've got like normal, maybe somewhat dry, but normal, healthy, non-inflamed pink tissue there. So things were resolved in a situation where resolution isn't normal. These things can last and last.
The leg, and especially the lower leg, heals very badly. That was one of my first skates when I bought the first scanner back in 1999. Somebody knocked at the door, and I forgot what he wanted, but it emerged I was a doctor. And as they do, when he'd say, "Oh, you're at a party," and you say, "I'm a doctor." "Oh, I've got this back pain. What do you think?" You get that. Well, this guy whipped up his trouser leg and said, "Can you do anything for this?" I said, "As a matter of fact, I might be able to." So it was almost, in the first few days of trying to use the first microcurrent therapy device, the scanner. And honestly, it was like this. It went from the one on the left to being closed over in 4 days. But on the second day, it had already closed. You wouldn't touch the electrodes on that left-hand one, would you? The guy'd scream because there's no
work around
it. But by the second day, there was a film over it, and I could, in fact, run the electrodes over that wound. And so it healed faster. And of course, by the end of the week, he was very well made up. I didn't charge him anything. I was grateful for the chance to practice.
Right, exactly.
Wonderful. Okay, now this is serious wound healing, skin grafts. John was asked to write a book on the use of this technology for wound healing by, was it the Malaysian government or just the Malaysian?
Yeah, it was the Malaysian Wound Healing Association. They got him to go and consult on a wound healing study using the devices. They had 100 people, all with diabetic foot ulcers, that were looking at amputation. The ulcers were bad enough that they could just stick their finger through the foot and it would come out the other side. Like they were fully open holes. And so he developed a really basic protocol for wound healing, and he was asked to write this book on it, and they had 100% success. Every single person's diabetic foot ulcer healed. And this has actually triggered us to do more research. We currently have a study going on at Stanford University, one at Baylor School of Medicine. We're trying to build a portfolio of studies so we can actually get FDA approval for wound healing.
Yeah. And this is what you see here is a skin graft, staples, there's a mesh to close over the hole, but I've forgotten the days there, but it's about a third day, isn't it? The one on the right.
Yeah.
Cells are beginning to form over the mesh.
And then these are backwards, but so the one on the right here is the next one, and then the one on the left is the final.
And the final, yeah. And what, a week or so? It was about 10 days most. Which for that degree of, a deep wound, I think is just nothing short of miraculous again. Okay, so we're going to talk to you about maybe, getting one of these or becoming a practitioner, learning this wonderful technology. And one of the things that's going to be on offer is this wonderful teaching program that Pain Free for Life have.
Yeah.
tell us about it, Rob, because it's
So
brilliant. Yeah.
one of the biggest things with this sort of technology, and the question that's on most people's minds, is how am I going to learn how to use this? Right? It sounds wonderful. And you know, the technology was originally developed for practitioners, so you maybe need a lot of knowledge. Well, we've really like made this easy to use at home. So I'll run through these, and I think we maybe have individual slides. So quickly, you know, we've got a training video library. We have one-on-one support, so everyone gets to work with a practitioner that is directly under us, so they know all of the stuff we know. You get access to a private Facebook group and access to our live crash courses. And John, my dad, and I, we do these live Q&As as well. So we want to head on to the next slide, Keith. I break them down in a little bit more detail. So the video training library.
That's a screenshot, isn't it?
That is a screenshot, yeah. So it's really easy to use. You log into it on your computer. There's a search bar. You type whatever you want to, like in there, Parkinson's, you know, the COVID, whatever it may be, and up pops a video. So this is a private platform, and it also has an app as well. So you'd be able to use it on your phone if you'd rather use the app. Personally, I think that you get more access to bigger screen and everything on a computer, but there's lots of different options to access it. And from getting started videos to just learning how to use the device to specific conditions, there's a video for that in this library.
Right. And it's brilliant. They're wonderful videos, short, but just absolutely what you need to know. Yeah. Yeah.
And it's really boiled down to nice, short treatments, right? People don't want to watch a 2-hour lecture on how to treat their sore throat. They want to know in 5 minutes, and that's the point of the videos. So treatment coordinator support, probably the best thing we've ever incorporated, is to allow people to have someone to work one-on-one with. Many people work better with a person. They like to talk to someone. They maybe they're unsure if they're doing it right, and they want to hop on a Zoom call and learn how. And unfortunately, like, though I used to perform this role, we just did not have the bandwidth for all of the clients we see. So I started this team. This is Annie on the picture here. She's our lead treatment coordinator, and we've expanded the team now. We have more treatment coordinators, and so it's keeping growing. This is included in the membership platform, unlimited access to your own treatment coordinator. You'll only work with that one person, so you get continuity of care. You're not going to be bounced between different people. And they're trained in our protocols. They meet with us weekly, so we can instruct them if there's anything new they've never dealt with before. And really, their goal is to build you a personalized treatment plan that will fit your goals for you, for your family. And one question I always get is, can I use it for my family? Absolutely. We've got one person that has 12 family members under one person. So use it as much or as little as you like.
Right. Can't be fairer than that. Oh, did I jump again? I think
you did a little, yeah. So the private Facebook page. So Facebook it's a decent program, but you know, I know a lot of people don't like it, but it does provide us a way to socialize. It's not a requirement to use Facebook. Everything but this page is off of Facebook. You don't need to use it if you don't want to. But this is really just like a social group, and it is private. So people on your friends list will not see anything you post unless they're also in the group. But we get people there. We have loads of practitioners, home users with like decades of experience with microcurrent, and from all different aspects of health. One of my favorites is we got a couple of dentists in there. So people are always asking about oral health and microcurrent, and they know how to use the devices for that. So you get some really neat feedback from people there. I think this really leads to a diverse healing experience, and it's something that we're pretty proud of as well. Right.
You maybe just want to comment, since you mentioned dentist. I know of nothing better for painful tooth, you know, dental abscess treatment. There's not much you can do apart from knock your head against the wall. It always happens on a Friday night, of course, so you can't get help till Monday morning. But the actually is great at killing pain of all kinds, including a dental flare-up. So that's a good reason to have one in the medicine cupboard anyway.
Absolutely.
Right. No, this is new to me, so you're going to have to talk all the time.
Yeah, no worries. So the live crash courses, I put weekly in there because that's when I used to have more topics to cover. Now they're a little bit more sporadic, but essentially members vote on what topics they'd like me to cover. And I put together 45-minute to 1 hour long presentations around that topic. So even if it's something new that we haven't covered yet, I do research, I put together a presentation, and we host these live. The best part about them is that even if you just received your machine, I walk through every step. So if I mention vagus nerve or turning on the device, I show you how to do it with all the different machines we have. So it's really a good way of you could jump into a crash course and you could treat that specific condition, even if you just received the device that same day.
Right. And then the monthly Q&A.
Yeah, so if you like just hanging out and chatting, that's really what this is about. We host these live Q&As. It's my dad, John, and I, we sit here. People ask us questions. Sometimes they stump us, and then we do research and we get back to them. But it's a really kind of an informal just get together, and questions often end up being about microcurrent or homeopathy. In John's case, he's a homeopath as well. So there's lots of different things that we cover there, but it's always a fun time when it happens. So we look forward to that.
Great. Right, approval, official approval. It's all very well, but what if the FDA banned it? It would all come to naught, wouldn't it? In fact,
Exactly.
you can boast rather well.
Yeah, we work really hard with the different regulatory bodies around the world to make sure that we're adhering to their quality standards. So we have been able to obtain and retain FDA approval, Health Canada approval, and European approval. And we've just recently, as of a couple of months ago, achieved a TGA approval, which is for Australia and New Zealand as well. So there's lots of different things they're approved for in different places. But, knowing that everything we've talked about today is pretty much approved in Europe, and that we're all humans that all have the same biology. So whether you're an American or a European, you're getting the same machine. You just have in America, it's approved for chronic pain, and that is it. Health Canada, it's pain, some neurofeedback, and some circulation enhancement, which goes to wound healing. And in Europe, it's everything we talked about pretty much.
Mm-hmm. Lucky Europeans, yes. Oh, well, we're going to talk about the possibility of you maybe purchasing one of these. So we're kind of doing it a bit backwards, really. But anyway, you look after your customers, don't you, basically? If somebody's not happy, they're not going to say, well, it's tough.
No, exactly.
We're not Walmart and things like that. Well, actually, Walmart's quite good, but you know what I mean.
Yeah, I know what you mean. Yeah, sometimes it can be a sale is final. That's not the case with us. You get 30 days from the day you receive it, so we're taking into account mail times. People usually get results within the first week or two, like we talked about today. So you're going to know it's working. And all of our devices can be returned within 30 days of you receiving it. There is a 15% restocking fee, and I just emphasize that the reason for that is we cannot resell used medical equipment. So if you use one of our devices and return it to us, we actually have to destroy it in order to stay, within the guidelines of the FDA and Health Canada. So that's the reason we have the restocking fee, is to try and absorb some of the loss if that ever happens. But it's very, very rare. Very rare.
And I think about the only reason people are not happy is they wish they'd bought the better machine.
Yes.
When they come, they want to upgrade. Can I have the bigger one? It's
yeah. And we do try and make concessions in cases like that. I think that the devices I have sitting in the office that have been returned, as you say, like most of them are because people are like, I regret this. I wanted this one instead, and they have to move up.
Yeah. Well, we'll talk about the escalating ladder of what they do. Anyway, so.
Yeah. So, we've really, just to recap, right? I mean, we've covered a lot already. And really what we now know is that in reducing and eliminating inflammation, we can resolve chronic pain and even chronic disease within the body. And that harnessing the frequency and energy within our bodies is the answer. So the next step is to figure out which device is going to fit your needs, should you decide you want to go ahead with this.
Yeah. Okay, so we start with the genesis, which is the base. Now, it's very important that you say this one, am I right? This one won't do vagus nerve stimulation. So,
yes.
It costs a fraction, but there's one missing big thing, which I I'd have trouble doing without. So
Yes.
anyway, tell us about, it's a great device anyway.
It is a great device, and it's got 4 programs. It can really address chronic pain and inflammation. It can treat scar tissue. It can help repair muscles. It's got the onboard pharmacy, every device does, and it's got the ability to stimulate acupuncture points as well. And it even has an automatic treatment mode. So if you don't know what you're doing, one of the best things you can do with this is you can turn it on and you can use the cycle mode, and it will treat automatically and tell you when it's done. So it'll run through the different programs in the right order. And so it will treat the soft tissue, the scar tissue, the inflammation, and do the regeneration. But Keith's right there. The key thing is that it cannot stimulate the vagus nerve. And that is the thing that really holds this one back. If you have body-wide pain, if you're an autoimmune disease sufferer, or your pain is not just shoulder or knee pain, this might be a bit of a struggle for you, because you'll be having to treat. You take this device and you're treating all over your body, right, to deal with all these different pain areas. With the vagus nerve, it goes on your neck and it does all of that for you. So just keep that in mind. This is a great device for people dealing with localized pain. And as Keith said, it's a fraction of the price, but it's just limited in some of the more advanced conditions.
Right. We both froze up just then, and it reminded me, I haven't gone back to no video from me. We don't need my video, do we, folks? Okay. This one.
So this is the Life Evolution. This is the middle device. It has 8 programs. It can resolve pain pretty easily because of the vagus nerve. Vagus nerve stimulation, obviously, improving sleep and stress. So all of the neurofeedback stuff we talked about. The ability to really work on most eye conditions. If people are dealing with macular degeneration, or they're having any issues with things like that, it's got the right frequencies to address those things. And then it can really do everything that the Genesis does, but it doesn't have an automatic treatment mode. We didn't have room to put it in. So that's not really a problem in most cases. It's really, that's the fallback mode for if you don't know what to do. But with the training, with the one-on-one support, with the ability to just stimulate the vagus nerve to work on most issues, you'll find this device is pretty easy to use as well. So you're doubling your programs and you're getting access to the vagus nerve and the brainwave stuff as well.
And these they come with manuals, don't they, Rob? You know,
yes.
Just you have to go online to learn. You can read the manual and you very quickly learn something like 350 hertz. That means acute inflammation. And, you know, pretty soon you get the hang of what those settings are, don't you?
Absolutely, yeah. They all come with printed manuals and ebooks. So you've got the option, whatever you prefer. You'll be able to work on those. Right.
Now, the big daddy.
Yes. Okay. So if you thought 8 programs was a lot, the Pinnacle jumps to 65 programs. It is also fully programmable, and you can save an additional 4 programs in it. So you can have up to 69 programs in it at any one time. One of the big things here is that 12 of the Pinnacle's programs are automatic treatment modes. And unlike the Genesis automatic treatment modes, these are specific to different conditions. So what this does is, you might have a nerve problem, you use the nerve mode. You know, you've torn a muscle or broken a bone, you use those modes. Wound healing, that mode, so on. It's really easily broken down onto a cheat sheet, actually, that you get in the package. And so you just apply the device, you set it up, you adjust the power, and it will change frequencies to the point where you wouldn't believe that it's actually making these changes. It might go from 2 hertz for nerves all the way up to 1,000 hertz, and you won't perceive the difference in sensation, which was a big achievement there. But it also has these modes are designed to push the frequencies deep into the body. So they'll get like as deep as we can get. You've got deep scar tissue modes for people that maybe had a hysterectomy or have really bad abdominal adhesions. All of these being automatic modes means you've got that ease of use. It's going to tell you when it's done, and the learning curve is gone from that. But you can then access a lot of the manual modes that we talked about already, things like chakras, meridians, different pain modes, different healing modes for different tissue types. All those things can be accessed as well, hence the sheer amount of modes. We also talked already about the diagnostic screen, but this is the only device that has that screen. Being able to touch it to the body and take a reading is just massively impactful to analyze and see what's going on within the tissue. But otherwise, this device, I really have got all these bullets here, but it can actually, if there's something you're dealing with and you don't know, you're going to have, Keith has talked about this before, this is like a hospital in your hand, right, Keith?
Yes, it sums it up beautifully.
Yeah, if you've got a problem, and you're planning on getting the Life Pinnacle, you're going to be able to do something about that problem. That's the breadth of the options that you have here.
Yes, superb device. I've got one, folks. Ooh, what have I done now?
We got to go forward a few.
Oh, forward. All right.
One more. There we go.
All right. Okay. So yeah, so this is a package. This is the simple one. It's very affordable though, and it can do lots of good things, but just be aware what it doesn't do.
Yes, exactly. So we've covered what it doesn't do. And this one, yeah. So normally our lifetime membership, which includes all of the training, all of the one-on-one support that we talked about, that's usually $2,000. So we're actually giving it away for free with any of these device packages today. So the Genesis in this case is $795 for this kit. You get pretty much all the tools you'd want with the Genesis device. And again, great for working on localized pain areas, dealing with scar tissue, but just keeping in mind it doesn't do the vagus nerve.
And I'm not seeing the comb device, Rob.
Yeah, the comb is not included in the Genesis because the comb is mostly used for working on the brain, and there's no brainwave frequencies in the Genesis. Right. So
also works on furry animals, though.
It does. If people are looking to treat their animals, they can you can add the comb on as well. But yeah, it will work with the Genesis.
Yeah, I mean, you can buy the comb device. It's not expensive. That's a nice basic kit with a really good, a nice basic price.
Yes.
So now, let me start here right now. We've got it up on the top left there. Anytime you think, I think I'll have one of those. Go and get yourself one. The link to go to is thesanashop.com and then /KSM for Keith Scott-Mumby, but all uppercase letters, KSM in uppercase. It doesn't matter, the Sana Shop, whether you use uppercase or not. Thesanashop.com /KSM. When we finish this, we're going to then swing into Q&A. And, if you made up your mind, I want to do something, just go ahead and do it. Click on the link or type in the URL, I should say, and just get yourself one.
Yeah,
okay.
Absolutely. Yeah, so this is the evolution one. And this one can do vagus nerve, you recall. So this is our mid-range device, and the full kit for that comes with more stuff than the Genesis, and is usually $1995. And again, usually you'd be paying another $2,000 for the membership, but that's being given away free with the webinar. That's the price of this one. One of our most popular machines, just I think because of the vagus nerve stimulation.
Just beware, you might want this next one eventually.
Yes,
if not immediately.
So if you're looking for the Pinnacle, the professional level machine, you're getting pretty much every tool under the sun. This kit is stuffed. We often struggle to close the case up, because it is so full of attachments. You're getting the Y electrode, the comb, the pencil, the tongue stimulator, the mitochondrial recharge kit, electrode for working cosmetically on the face. You're getting ear clips, all the pads, right? You're getting a lot of stuff in here. Now this kit is our most expensive at $4,995, but you're getting the lifetime membership for free as well. And again, this is truly the hospital in your hand. This is the one you want if you want to tackle anything that you think you've got going on.
It covers almost anything that could happen to you in life and your family and loved ones.
Absolutely,
pretty well got it covered with that. Even somebody breaks a leg, you think, well, that's ER. Well, yeah, maybe to get a pot fixed, but I would still want to be treated with the Avaxia to get rapid healing. My son's a chef, and he skidded on a greasy kitchen floor once and broke his ankle clean through the ankle joint. It could have broke about 4 bones at once. So they fitted a pot, and of course I couldn't get at it because all the trouble was behind the plaster of Paris. So I treated the other side. Now, what a doctor would expect to see with a broken ankle, lower limb, is about 6 months, 3 months of healing. The initial phase where the bones join and then the completion of the process. He was back at work with a pot off in 3 weeks.
Yeah.
They couldn't believe what they were seeing at the hospital.
That sounds right. Yeah.
And I never once touched the injured leg. I just worked on the opposite side. That's how powerful it is. Okay, so we're going to go on to Q&A shortly.
Yes.
So just summarize it again for us, Rob.
Yeah.
And I'll put up a permanent screen which we can show while we're doing the Q&A. Okay.
Yeah. So just to summarize the 3 we've been through here, the Genesis Deluxe Kit, all of these come with the lifetime membership. The Genesis Deluxe Kit is $795. And these prices are in US dollars, by the way. Our store has changed recently. So if you're visiting from a different country, it'll give you the option to shop in your local currency. So if you see a price differentiation, if you're using, say, Canadian dollars or pounds or euros, it will be because it's switched to your local currency. So you just have to keep that in mind as well. So $795 for the Genesis, $1995 for the Evolution, and $49.95 for the Pinnacle, all with the free lifetime membership. Now, these special offers are only available for a week. So next Saturday, we will be closing the ability to buy them. And you do have to go to that specific link to buy them on the top, thesanashop.com/KSM for Keith Scott-Mumby.
Yay. Okay, so I'm going to leave this screen up while we do the Q&A.
Yes.
And what I'm going to do for the moment, guys, is I'm going to stop the recording and then restart it for the Q&A.